I'm not kidding, I've been setting up to start filming this video, and legitimately 10 seconds before I hit record, a jackhammer started going right outside of my apartment. The wonders of living in a city. Hey friends, welcome back to the channel and welcome to this video. My name is Steven and I'm a third year dental student. I think it's been a while since I've just sat down and talked about dental school and what's going on and just explained kind of some of the ins and outs of the psychology of being in dental school and just some of the things that are involved in this process. You've seen the title of the video, you've seen the thumbnail. In this video, I'm gonna be talking about failure, which is something I've recently experienced a little bit in my third year of dental school. I wanna be frank with this discussion. I wanna be open and honest because I think there is a lot to gain from this discussion from a third year dental student. There's a lot that you have to go through in the process of becoming a dentist. I'm sort of at one stage of it. Many of you might be at a previous stage to where I'm at. So hopefully there are some things you can take from this video as I enter and discuss the topic of failure. In undergrad, I didn't really deal with failure a whole lot. I worked really hard to get A's in all of my classes. I didn't always get A's in everything, but that was always the goal. I would sit down at the beginning of a course, especially a science course in undergrad, and I would say, how can I get an A in this class so that I can get into dental school? And that was the process that I went through for a few years. Once I got into dental school though, I was sort of like, well, my plan is not to specialize, my plan is to be a general dentist, so basically I need to just get through, become a dentist, get my license and be able to practice. And so there's sort of a shift in the mentality there. But dental school throws its punches and it does that frequently. So throughout the process, I've experienced some closeness with failure, some chances of getting really close to it, and then some times where I actually did fail. And the most recent time where I experienced failure in dental school is what actually sparked this video. I was sitting down to do an endo-sim in my third year of dental school. An endo-sim is essentially, in order to do endodontics or root canals on live patients, we have to go through a bunch of these sims where we do root canals on a extracted tooth and a mannequin head. And we have to do that a lot in order for the faculty to have enough trust in us to allow us to do a root canal on a live patient, which is a very technique sensitive process and not something that they want to just throw students into. Now, this was my 5th endo-sim. I did 4 endo-sims with great success. I had done great root canals on 4 separate teeth, and it was my 5th one that I was attempting, which in fact was my comp. So this is the sort of culmination of all of those endo-sims coming together. If you pass this comp, if you do well on this particular root canal with this tooth, they will allow you to start treating live patients. And I was really, really excited about that. I picked a tooth, I mounted it, I went through the process, and I started to cut my access preparation in this tooth, which was an upper canine. I believe it was tooth number 6. Starting to cut this access preparation, and I cannot find the canal of this tooth. I believe the tooth had come from an older patient, so the canal was very calcified. There wasn't a whole lot of coronal pulp. Basically, the pulp started at the CEJ and then went apically from there. It was very, very small. There was probably just a little pinpoint that came up to the coronal portion of the tooth, roughly at the CEJ. And so I'm searching around with my burr trying to find this pulp. I keep taking instruments and feeling down there to see if I can feel any semblance of an orifice, and I'm getting nothing. And of course, this is a comp, so I'm really worried about the grade. I'm concerned about just passing and getting through this thing. And I'm sitting there with a burr for 30 minutes, 35 minutes, 40 minutes trying to find this canal. And usually for reference, I find the canal within like the first 5 minutes or so, or for first 5 to 10 minutes. Boom, I find it, and then I can start working on the actual fill. But here I'm sitting here and I just can't find it. And I'm starting to freak out, starting to sweat, starting to get nervous. It's a single rooted tooth, so it should be somewhere in the middle, but because the pulp was so far apically, I couldn't tell where I was and I couldn't tell like how far I had gone. So I started to search buccally and lingually. And in the process, I basically obliterated the buccal wall of the access preparation and I severely compromised the structure of the tooth. Of course, I went on to finish the root canal, but the whole comp was a failure. I spoke with the professor, the doctor that I was working with, and he kind of helped me and showed me where I had gone wrong. But I'm not gonna lie, I was extremely, extremely defeated. I think the most difficult part of something like that is I'm sitting there realizing that I'm gonna fail something that I'm working really, really hard on. I'm stressed about it, I'm sweating, I'm putting in all this mental and physical energy into this thing that I know is a failure. And that in itself is frustrating, but then I have to realize that, oh yeah, tonight I have to go home and I have to study for a pathology test that we have next week. and there's no break from this whole process. The thought that kept coming to my head was that dental school just kind of keeps kicking you. Even if you're down, it's gonna keep kicking you. And this isn't always the case. There's been many points in dental school where I've had the ability to sit back and relax and enjoy life. But there's also these points in school where I am just absolutely brutally kicked over and over again, and it beats me over the head, whether it's clinically or didactically. And this process, it just sort of hasn't ended in dental school. Of course, we get to the next week, which is this week, and we have that pathology test, and I did very poorly. I think I thought I prepared really well. I spent so much time, learning all of these pathologies of the oral cavity, and I had spent time researching and looking into all of the clinical features and the treatment and histological features and all of this stuff. And I got on the test and I just didn't do well, I don't think. I haven't gotten my grade back, but it didn't go well and I didn't feel good about it. So in the span of like 5 to 7 days, I had experienced a genuine failure in an endosim, something clinical, and then I experienced probably most likely a failure in a didactic test, and it just hasn't been a good feeling. So that sparked me to get on here and talk about failing, and that's something that I think not everybody is necessarily going to deal with. There are people that are much, much smarter than me. You very well might be one of those people. But if you're like me at all, and a generally average, pretty good, decent student, whatever, you're gonna get to dental school and there's going to be things that you failed. And for the record, I've failed things in the past as well. I failed an endo practical. When I was a second year dental student, I failed, and I think I've talked about that on the channel, but endo seems to get me from time to time. I do think I'm decent at endo, but there are things that tend to get me. And I've also failed other practicals and operative and things, and it's really, really frustrating. And I can't quite figure out why it's so frustrating, but I think the reason is you're putting in so much time and effort into this thing, and when you get a result that is a failure, it's just frustrating and it causes you to kind of look down on yourself, I think is the result that I've gotten. What I want to try to convey to you in this video, despite the fact that there is literally a jackhammer going on outside my apartment, is that you're going to fail. Everybody is, and it's sort of just how you respond to that failure that's going to decide how you move forward. Dentistry is a very, very difficult craft. It's not easy by any means. There are certain aspects of dentistry that you might find yourself picking up pretty quickly, but generally speaking, the profession, the job, the role, the art, science, the practice of dentistry is not easy. I think that the more you get into that, the more you realize how true that actually is. You need to prepare yourself to fail. Prepare yourself to not do well on certain things. Because if you go into it like I do, where it's like this fear of failure, and it's this thing where it's like, I'm trying to avoid that at all costs. When you do actually fail, you're gonna be devastated, just like I've been. I think going into it with realistic expectations of yourself is probably the best way to do it. Realize that you're learning a ton of things, both clinically, didactically. They're teaching you about all of these different sciences. They're teaching you about the different pathologies of the human body, all of the pharmacologies, and then you're also expected to go into the clinic and care for real human lives and do these clinical things, various different specialties of dentistry. You're doing all of that in one go, and that's not easy to do. Even the best students in my class, the best of the best, the ones that are gonna go on and specialize, the super smart ones, the ones that are great clinically, even those people fail. Everybody does. You're not gonna avoid it. It's something that is just a staple of this profession. That doesn't make it not frustrating. That doesn't make it easy or not difficult. It's always gonna be those things. But what you have to realize is that if you do fail, it's part of the learning process. Let's say I had gone into that comp in endo and I had passed it. Great, I get to go and treat live patients. Well, what if I'm treating a number 6 on an actual live patient and I had the same problem? Let's say the patient is in their 60s and I can't find this canal because it's calcified. I probably would have done the same thing that I did in this comp on that actual patient, but instead of it just being a failing grade and one that I have to redo, I've actually structurally compromised a real patient's tooth. That's not what we want. So in reality, it's a good thing I failed because I learned something. I learned that I was way too buccal in my access preparation of an upper canine. The canal was actually much more lingual. I know that now. And so I know when I go to cut a preparation on that tooth, I need to search from the center towards the lingual slightly and stay away from the buccal. That was a learning experience for me. And I was able to do it on a fake tooth, an extracted tooth in a mannequin, that was mounted in cement and not on an actual patient's tooth. Dental school is about learning. It's not about mastering everything. And I think the quicker you realize that, the more grace you'll give yourself. Like I said, the worst part about this was how I was treating myself in my own head. I was telling myself, you've failed. You're a failure in some regard. You're in your third year of dental school and you're supposed to be good at this stuff, and you're not. You're not doing it the correct way. And that's really tough to deal with. But every time you fail, there is an opportunity to learn. Even in the pathology test that I took this week, which once again, don't have the grade yet, but there was an opportunity for me to learn there. I learned that what I was doing to study, which was simply looking at Anki cards over and over and over and over and over again of just all of these random facts from tons and tons of material. That isn't the best way to learn this stuff. The best way to learn it is actually to sort of take the histology, for example, of all of these different pathologies and put them on one page so that you can compare and contrast the differences and the similarities in the histologies of these different pathologies. That allows your brain to actually connect the dots a little bit more, which is the type of questions that our professors like to ask. They like to compare the different things as opposed to simply asking you facts about each one of them. And that's something that I learned in failure in this last exam. So whenever you fail, it sucks. You're not gonna enjoy it, but try to take a step back. Realize that number one, what you're doing is great. You're studying to become a dentist. This is something that you've wanted for so long. It's gonna hit you. It's gonna take its shots at you. But at the end of the day, you are doing what you've wanted to do for so long. And also realize that this failure is an opportunity to learn. Ask yourself the question, what did I do wrong and how can I avoid that in the future? That's the most basic and simple way to look at failure. It's not easy because emotions enter the equation and you're sitting there kicking yourself. But try to ask yourself the objective question, what did I do wrong and how can I avoid this in the future? That is the way to find success through failure. And I'm gonna tell you this as well. I haven't become a dentist yet. So I'm really praying that I'm able to make it through. But when I do become a dentist, I'm undoubtedly will continue to experience failure in my own clinical practice, and you will too. This never ends. Even dentists who have been practicing for 45 years say that they mess things up, they fail at things because it's not something that we ever fully succeed at. We practice dentistry, we don't master dentistry. So understand that the way that you handle failure now in undergrad or dental school is sort of an opportunity for you to manage it so that when you experience it in your clinical practice, when there are financial ramifications and personal ramifications for the health of your patients, you can understand, I know how to deal with this. I've dealt with this many times before. I'm going to learn from this and I'm gonna move forward into the future. I think the third year of dental school for me has been the toughest so far. And I've said this literally every semester because it's been like this. It's been continually getting more difficult for me. I think the third year has been the most difficult because now I have the lives of real people that depend on me in a certain sense. And I have to deal with that on top of dealing with my own personal learning, my own personal studying, the time I spend trying to learn all of these things. It's a lot to balance now, but it's a great opportunity. And years ago, when I was in undergrad, I used to think about the prospect of becoming a dental student. And I used to look forward to it greatly. I used to look forward to calling my dad on the phone and talking to him about doing a cavity, preparation or doing a root canal or something. And now, these days I do call him on the phone and I describe the very specifics of the clinical side of these things. And occasionally I take a step back and I realize this is just what I've wanted to do for so long. And it has been really rewarding. In fact, yesterday I did a wonderful filling on a patient that I was super proud of. Really big filling, big composite that I ended up contouring to make look exactly like a natural tooth. It was awesome. I was proud of that. Point is, there's been ups, there's been downs, and that is just the reality and the truth of dental school. My mission on YouTube has always been to be an accurate portrayer of the dental school experience, an accurate historian, telling you the truth, being honest with this process. It isn't all roses. It isn't all nice and fun and great. There are many aspects of it that are difficult and challenging. That being said, it's doable. Everybody who is watching this video, who is passionate about this topic, passionate about becoming a dental student, you all have the capability to do this, and I know that for a fact. So if you take anything away from this video, it is continue to work hard, continue to learn from your successes and your failures. Even if you succeed at something, ask yourself the question, what did I do correctly that time that allowed me to succeed in this particular event? And then use that moving forward and combine that knowledge with the knowledge that you get from your failures. And I promise that at the end of the day, you will continue to be a lifelong learner. You will continue to be a student in every aspect of your life, but you will move forward and continue to grow personally, clinically, educationally, whatever it is. I appreciate you all for watching. Things have been very, very busy. I used to try to shoot for a video a week, and I'm thinking nowadays it's going to be more difficult for me to do that at this point in my life, this semester, in this year, whatever it is. But I do still have a great passion for YouTube, and I'm looking forward to continuing on with this channel and just bringing you through the third year of dental school, the fourth year of dental school, graduating and becoming a dentist. I think a lot about the content that I'll be able to make when I'm actually a dentist and running a practice and practicing every day. If you want to be a part of that process, make sure that you subscribe to the channel right now. It's free, it's easy, it's one button, and it helps me to know that people are still out there watching and appreciating the content. And for those of you who made it this far into the video, thank you so much for continuing to support me. We are coming up on 10,000 subscribers, which is unbelievable. That's a goal that I've looked forward to for a long, long time. Even before I'd reached 1,000 subscribers, I looked at 10,000 as sort of a great pinnacle, and we're only a couple hundred people away from that. So if you have any friends at school or friends at home that are interested in becoming a dentist or just learning some life lessons, and seeing a guy struggle through his experience in school, tell them about the channel and they may find something that they enjoy about it. And for those of you who are wondering, Daisy is doing great. She's actually home in Nashville with my girlfriend right now. They're having spending the week together. I just figured I would have her watch Daisy for the week so that I could stay here and study and get things done that I needed to get done. But she's doing wonderfully. She's gotten so big. She's so good, and I love her and I miss her. But life is good. Life is tough, but it's good. And I do appreciate all of you. Also, if you have any recommendations for the 10,000 subscriber giveaway, which I want to do very, very soon, let me know. I want to do a couple of different prizes for this particular giveaway. I just haven't figured out exactly the details of that. So if you have any recommendations of things that I may be able to do for people with very limited money that I currently have, let me know. Friends, I appreciate it. Thank you so much for watching. Don't kick yourself too much when you fail. It's natural and it's part of the process. As I always say at the end of my videos, I will see you in the next one.